Greetings to co-email viewers. The number of diabetic patients in India is increasing so much that we are often referred as the diabetic capital of the world. Diabetes brings a lot of comorbidities. One of them is it brings a very big threat to our eyes. We have with us Dr.Ashish Sharma, who is a retina specialist and an innovator, who will talk about why a retina specialist is needed in examining diabetic patients' eyes, and also he'll share with us about one of his inventions, that is MII Ret Cam, which is actually a big game changer in this examination process.
The diabetes affects the retina device that we have innovated, which is called the MII Ret Cam. About this concept to our Honorable Prime Minister Narendra Modi ji, we got immediate response, and I was called by him to his office, and we explained that how this device can help. Any hospital, even a NICU, has to spend almost minimum 15 to 20 lakh rupees. It goes till 1 crore. You can just put that glasses on, and that glasses will give you the complete information, retina pictures and everything on your smartphone. Most of the people are aware that heart is an organ which gets affected, kidney is an organ which gets affected, but actually speaking, I am a retina specialist, and we see that 1 in 3 diabetic have a chance of blindness, because diabetes directly affects a very important part of the eye, which is called the retina. Sometimes patients, they are not aware that they actually need an eye checkup. Usually what happens is, whichever diabetic specialist they are seeing, the diabetic doctor should refer them to an eye specialist, and it is always preferable if he refers these patients to a center where facilities for the retina examination, including doctor and the instruments, are available. The reason behind going and checking with the retina specialist is because diabetes affects the retina, and that is the cause of blindness. What happens, sometimes people who are not aware that retina examination is required, they end up visiting a general ophthalmologist or a place where examination of retina facilities are not available. So what happens, it is like they enter and they just get their glasses checkup done, and they end up coming out of the hospital with just change of the glasses, which is not the complete examination. To completely examine a diabetic patient, we need to put the drops in the eye so that retina can be examined. It takes around 1 hour, 2 hour time, and the retina specialist is the right person to identify what kind of damage and what kind of a stage of the effect of diabetes he has in his retina. The device that we have innovated, which is called the MII Ret Cam. What we found and we saw in our practice, because I deal with diabetic patients who are having all these retinal issues on a day-to-day practice, and we have seen this over the years, that there are very few centers in this country which are equipped with the machine which is called the fundus camera. Fundus camera is a machine which is required to capture the retina pictures, so that we know as a screening tool that what is the kind of damage the patient has. But those machines were limited to a very few centers in the country. This country is very big, vast country, and we have almost quite a huge population of diabetics, which is going to grow over the time. So if we really need to provide care to these patients and screen all these patients, we needed some kind of cost-effective device. So that's where the thought came in. And the other point that we saw was, although there were centers who were equipped with this kind of cameras, these cameras were very bulky. So even it was difficult for us or any doctor to transport it. So the movability was poor. Then we decided in 2015, we had a brainstorming, and a smartphone is a device which has all the kind of camera capabilities. So we thought, why don't we utilize this? And then we designed the device called MII Ret Cam as a prototype. I should thank Amrita to give us a prototype for that. And with the help of prototype, we validated this device in 2015. And within short time, when we wrote about this concept to our Honorable Prime Minister Narendra Modi ji, we got immediate response, and I was called by him to his office, and we explained that how this device can help. And then over the time we went for the commercial development, and now this device has reached in 42 countries, with having almost 15 scientific papers published globally by using this device to provide the care to all these diabetic patients. Whenever a premature baby is born, a pediatrician who is involved in the care of that premature baby, he always asks an examination by a retina specialist. But what happens, even when a retina specialist, he examines the baby and he recommends that this child needs a retina treatment, sometimes it's very difficult to convince the parents. So what is the best way to do is, you take a picture of the retina of that baby and then you show to the parent that this is the normal picture of the baby, and your baby's retina is like this, there is a bleeding inside. Then they have a better conviction level to go ahead and give a green signal for the treatment. And to capture that image, any hospital, even a NICU, has to spend almost minimum 15 to 20 lakh rupees. It goes till 1 crore. That is where the device MII Ret Cam has made a huge difference, because it costs just 20,000 rupees and it can be carried to any NICU very easily. So, and it has been very well tested in the premature babies. There is a model, like a protocol model and a standard model, that we designed and tested this device in premature babies, and it is accepted by the American Academy of Ophthalmology, and it has been published in their journal also, and the model name is Smart ROP Care. Whenever the retina is damaged because of the diabetes or because of the prematurity, which we call as the retinopathy of prematurity, once it has caused the damage, it is very difficult to make it completely normal. We can prevent the damage going further, but we cannot revert it. So it is better always to avoid the damage going forward rather than waiting for the damage to happen. Yeah, that's a very important question that, in some way, I feel that I am fortunate in terms of the exposure that I had in the early life as a physician. After seeing the system in the United States, when I came back to India and I started working here, I came back in 2010. So for next 3 to 4 years, then I start working in the field, and working with a lot of patients who couldn't afford, even a lot of hospitals, when we saw a lot of people, just because not having the machine, they are not getting the entire care. So we thought, Where is the problem statement? Problem statement is just that we are not equipped well. So I think that's where you start thinking, and once you start thinking, then you find the ways. And I was fortunate enough to have a team where we had a support and my patients. And to be frank, this would have not been possible without my patients, because our device manufacturer is a patient, Microtech, and our software also designed by one of my patients. So we could get a team which could do it. And fortunately, I am working in a hospital which is called Lotus Eye Hospital, an institute at Avinashi Road, and our chairman, who recently passed away, Dr. S.K. Sundarmurthy, he has provided me complete freedom to explore and try to find out new ways, the best way you can provide a care to these patients. So I think I got a conducive environment with a little bit of zeal to provide a good care to the patients, apart from routine whatever we do in our day-to-day clinical practice. My dream is, rather than depending on any institute to get the retina checkup done, I would just compare it from the old time. If you remember your time of your grandparents or parents, even for a simple blood sugar checkup, they were going to the clinics, isn't it? So over the time, what happened? Now you can check your blood sugars at home. Now you can check your blood pressure at home. So in my personal opinion, the only way we can prevent the diabetic blindness in this country, or probably globally, to have a home monitoring device, which we are working on. We call it as a RIGS, retinal imaging glasses by Sharma's. So what it would do is, you have RIGS at your home, and as soon as you are diabetic, you can just put that glasses on, and that glasses will give you the complete information, retina pictures and everything on your smartphone. And because nowadays we have the artificial intelligence, which is quite progressing, and artificial intelligence automatically says, okay, your retina is not damaged, your retina has a slight damage, your retina has a more damage, and according to that it gives a warning, and it gives a signal that okay, you need to see a retina specialist, you need not to see a retina specialist for a year. So in this way, what it would do is, it will reduce the burden on the retina specialist, which is very few in number in this country and globally also, and it will take care of all the patients and bigger population. That's what our dream, and we are working on that project day in, day out. Apart from that, side by side, we are working on another software which is called the Diabetic Blindness Free India app, which is underway, which can connect the people who are suffering from diabetes, so that they can get early warning signs and early checkups done. So that is where we stand as of now.